Progress.
The gastrointestinal system. Examination of the abdomen. Here is an extract from a textbook description of how to examine the abdomen. Note if the abdomen is distented by fluid or gas. The presence of fluid can be confirmed by demonstrating shifting dullness, percuse, or tap. First, with the patient lying supine, flat on their back. Then ask the patient to lie on one side the percuse again. If fluid is present, the dull note here on percussion move. Palpate each region, feeling for a tenderness, pain when touched or moved. Palpable enlargement of tissue. Note also any warning or rigidity shown by contraction of the abdominal muscles. Warding may be due to tenderness or anxiety and can be reduced if the patient is persuaded to relax. Rigidity, however, is constant and is due to peritoneal irritation. Rebound tenderness is pain when the palpating hand is suddenly removed. It is a sign of peritonitis. Listen to bowel sounds. The feces. There are several words for the feces. Doctors sometimes say, there was blood in the stools. Have you passed black stools? Patients sometimes say, my motions have been very lost lately. Bowel movement is used to refer to defecation. Have your bowels moved today? Have you had a bowel movement today? Bowel habit is a medical expression meaning the pattern of defecation. Have you noticed any change of bowel habit? How often do you open your bowels? Are you going to the toilet more often than usual? Change in bowel habit could be constipation, hard, infrequent stools, or diarrhea. Frequent soft or liquid stools. Normal stools are brown in color and semi-solid or form the consistency or degree of hardness and softness. Can be shown on a scale. Hard, formed, semi-formed, soft, loose, liquid, watery. The color can vary from black due to altered blood, as in melena, to yellow, green, or even white. Melena stools are often described as sterile, like tar, the black sticky substance that is used in broth making. The stools may be red when fresh blood is present. Blood that can only be detected by special test is called fecal occult blood, FOB. When there is a high fat content, the stools are pale and are sometimes described as clay-colored. Stools that are large in volume are described as bulky. A bad smell is described as foul or offensive. Chapter 21, Gynecology, the female reproductive system. womb, ovary, neck of womb, cervix, vagina, fallopian tube. Menstruation. A period is the common name of a menstrual monthly period. The onset of menstruation is known as menarche. The last menstrual period is commonly abbreviated in doctor's notes LMP. 262 ago means the last menstrual period was 2 weeks ago. The menstrual cycle or length and frequency of periods is usually written in the form 428, which means lasting 4 days and occurring every 28 days. Is a period lasts more than 4 or 5 days. It can be described as prolonged. The term heavy periods means excessive blood loss. Menorrhea, often with the passage of clots. Coagulate blood. The term period pains means dysmenorrhea or painful menstruation. The time when a woman stops menstruating, normally at about the age of 60, is called the menopause or climatic. In everyday English, it is known as a change of life or simply the change. Symptoms of the menopause include hot flushes, sudden sensations of heat, and night sweat. A gynecological consultation. A gynecologist is talking to a 30-year-old woman. Gynecologist. Are your periods regular? Yes. How often do you get them? Every 4 weeks. How old were you when you started to get them? About 12. When was your last period? A week ago. How long do the periods last? Usually 4 or 5 days. Will you say they are light or heavy? Light. Do you get clots? No. Do you get period pains? Not really. Is there any discharge between the periods? A little. What color is it? White. Contraception. For women, methods to prevent pregnancy include the oral contraceptive pill, known as the pill, the diaphragm, and the intrauterine device, IUD, or copper coil. Condoms are available for both men and women.